Welcome to NCLEX over NCLEX. This video is about fundamentals of nursing question and answers. Don't forget to pause to get more time understanding the questions and rationales. A medication is prescribed to be given QID. What schedule should the nurse use to administer this prescription? Answer: A. Rationale: A. Provides the best schedule, because QID means 4 times per day. B, C, and D provide incorrect dosages. Question 2. When making the bed of a client who needs a bed cradle, which action should the nurse include? A. Teach the client to call for help before getting out of bed. B. Keep both the upper and lower side rails in a raised position. C. Keep the bed in the lowest position while changing the sheets. D. Drape the top sheet and covers loosely over the bed cradle. Answer: D. Rationale: a bed cradle is used to keep the top bedclothes off the client, so the nurse should drape the top sheet and covers loosely over the cradle. D. A client using a bed cradle may still be able to ambulate independently. A. And does not require raised side rails. B. C. Causes the nurse to use poor body mechanics. Question number 3. Before administering a client's medication, the nurse assesses a change in the client's condition and decides to withhold the medication until consulting with the healthcare provider. After consultation with the healthcare provider, the dose of the medication is changed and the nurse administers the newly prescribed dose an hour later than the originally scheduled time. What action should the nurse implement in response to this situation? A. Notify the charge nurse that a medication error occurred. B. Submit a medication variance report to the supervisor. C. Document the events that occurred in the nurse's notes. D. Discard the original medication administration record. Answer: C. Rationale: the nurse took the correct action and should document the events that occurred in the nurse's notes. C. A. Did not occur and B. Is not indicated. The medication administration record is part of the client's medical record and should be placed in the chart. D. When no longer current. A nurse observes a student nurse taking a copy of a client's medication administration record. When questioned, the student states, "Another student is scheduled to administer medications for this client tomorrow, so I am going to make a copy to help my friend prepare for tomorrow's clinical." What response should the nurse provide first? A. Ask the nursing supervisor to meet with the students. B. Notify the student's clinical instructor of the situation. C. Ask the student if permission was obtained from the client. D. Explain that the records are hospital property and may not be removed. Answer: D. Rationale: the nurse should deal with the issue immediately and explain that a client's records are the property of the hospital and cannot be removed. D. Even with the client's permission. C. Next, the clinical instructor should be notified. B. So that all students can be educated regarding copying and removing clinical records from the healthcare agency. The nursing supervisor, A, should also be alerted to ensure appropriate supervision of students as well as protection of client information. A client who has moderate, persistent, chronic neuropathic pain due to diabetic neuropathy takes gabapentin, Neurontin, and ibuprofen, Motrin, Advil, daily. If Step 2 of the World Health Organization, WHO, pain relief ladder is prescribed, which drug protocol should be implemented? A. Continue gabapentin. B. Discontinue ibuprofen. C. Add aspirin to the protocol. D. Add oral methadone to the protocol. Answer: A. Rationale: based on the WHO pain relief ladder, adjunct medications, such as gabapentin, Neurontin, and anti-seizure medication, may be used at any step for anxiety and pain management, so A. should be implemented. Non-opioid analgesics, such as ibuprofen, A, and aspirin, C, are Step 1 drugs. Step 2 and 3 include opioid narcotics, D, and to maintain freedom from pain, drugs should be given around the clock, rather than by the client's PRN requests. Question number 6. A middle-aged woman who enjoys being a teacher and mentor feels that she should pass down her legacy of knowledge and skills to the younger generation. According to Erickson, she is involved in what developmental stage? A. Generativity. B. Ego integrity. C. Identification. D. Valuing wisdom. Answer A. Rationale. Healthy middle-aged adults focus on establishing the next generation by nurturing and guiding, which is described by Erikson as the developmental stage of generativity, A, and is characteristic of middle adulthood. B, C, and D are not stages of this age group according to Erikson's psychosocial developmental theory. Last question. A male nurse is assigned to care for a female Muslim client. When the nurse offers to bathe the client requests that a female nurse perform this task. How should the male nurse respond? A. May I ask your daughter to help you with your personal hygiene? B. I will ask one of the female nurses to bathe you. C. A staff member on the next shift will help you. D. I will keep you draped and hand you the supplies as you need them. Answer B. Rationale. Many female Muslim clients are very modest and prefer to receive personal care from another female because of their religious and cultural beliefs. The most culturally sensitive response is for the male nurse to ask a female colleague to perform this task. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to like, comment and subscribe,